Hello, my name is Alexandra Martinez, and I am a nursing student at OSU-IT. I'm here to talk to you a little bit about preschoolers and dental hygiene. Today I have here with my son Nathaniel, who's going to help us with the demonstration part of today's discussion. First, I want to talk to you a little bit about the preschoolers. They are the age between 3 and 5, and this is a stage where they're really learning new skills and to branch off from the adults. They want to individualize themselves, so they're learning new skills and trying to do things on their own. And this is something we need to encourage them to do. We want them to be learning new skills. We want them to be able to learn to do things on their own. We want them to branch off and get a little bit of individualism. Yes, we still need to be there for encouragement and support and for help, and there are some things that they can't do by themselves yet, which is fine. But we want to encourage them to do things on their own and learn these new skills, because this gives them a sense of accomplishment and pride, and they enjoy learning these new skills. So by the age of 6 months, most people are expected to have a dentist for their children, and by this time we should start seeing the dentist, and we are expected to see the dentist every 6 months for your routine checkups and cleanings. If they will check to see your teeth, they will check the kids' teeth to see if there's any caries or anything abnormal, and if they do find something, they will of course let you know and schedule appropriate further appointments after that. So brushing their teeth is something kids can do on their own, and we want to encourage this skill and individualizing. So they are allowed to brush their teeth by themselves, but I would recommend supervision, even for my son here, who is at the end of the preschooler years of 5 years old. So they can brush their teeth, but flossing is something that they cannot do yet, and that's okay. It's just the skills that they haven't learned yet that they will learn in time. All right, so we're gonna go ahead and brush our teeth. Alright, first I want to talk to you about the toothbrush. It is said that you want to pick the appropriate size brush for the child's mouth. We want a small round brush with soft even bristles, so that they don't hurt the gums. Alright, and for the preschooler age, it is said to that they should be getting a pea-sized amount of toothpaste. So this is something that the parents should do so that they don't get too much or too little. Okay? There you go. Go ahead, brush your teeth. Good. Get in the back there. Up and top. Good. Alright, don't forget the front teeth. Good. Alright, let me see. Good. There you go. Spit. Rinse off the brush real good. We don't want any toothpaste caked on the brush either. Alright, you need to wipe your mouth. There you go. Alright. And see how I encouraged him and I reminded him what to do just in case he wasn't getting there? This is how you can encourage and provide support and supervision for a child while they're brushing their teeth. And if they don't look like they're doing very well, or they need some help, just offer it to them gently. Say, you did a very good job, let me help you get the rest, and finish it for them, which is completely fine. Alright, baby, you can go if you want. Alright, next I want to talk about the appropriate times to brush your teeth. You want to brush your teeth every morning, every night, and technically after every meal, but a general time of 3 times a day. Next, I want to talk a little bit about dental caries. It is pretty much well known that sugars are what causes cavities. And the best way to get rid of cavities altogether is to cut out sugars. But that's a very unrealistic goal. So what professionals recommend is reducing the types of sugars that you eat versus just cutting out sugar altogether. The types of sugars that we should spend less time eating are your lollipops, your caramels, your gummies, anything chewy and sticky, because they stay in the mouth longer and therefore the sugar is in the mouth longer. So it's different than eating something like a candy bar where you just chew it up, you swallow, and it doesn't linger in the mouth any longer than that. It is also a good idea for you to eat your desserts right after a meal. That way you're going to brush after instead of having little candy snacks in between instead. Another thing we want to talk about is sippy cups and bottles. We're hoping most people at this time have their kids weaned off the bottles. If not, that's okay. It's a process, I know. And sometimes even people have them off the sippy cups too, which is great. But I know in my own experience that at this age we're still doing sippy cups, and that's fine. The one thing we want to not do with the sippy cups is send them to bed with milk or juice in it, because milk and juice have sugar in it, and when you send them to bed with it, it pools in the mouth, and it's that lingering kind of sugar that is not good for the teeth. So we just don't want to send them to bed with milk or juice. If the kids are crying for a drink with bed, that's fine. Water is the perfect substitute, and that should make them happy. All right, I think that is about it. Thank you for listening to my discussion.